My friends, this is Dr. B, the best doctor in medicine and the most caring doctor in medicine. After more than 30 years at high level in medicine, Dr. B wants to remind you to never ever forget that Dr. B genuinely loves you and Dr. B genuinely cares about you, and I say this from the bottom of my heart. Dr. B today wants to tell you about why is it that it is so expensive to get health care in America right now, October 2025, and why is it that the cost of healthcare in America, which is the number one most expensive country in the world when it comes to the cost of healthcare, and why is it that it's going to get worse and worse and worse and worse? America, where Dr. B lives right now, October 2025, in this beautiful but expensive, super expensive city of Mountain View, California, is the number one spender by far in the entire world on healthcare. Every year, the American population spends about $4.9 trillion on healthcare. I'm not talking about millions or billions, I'm talking about trillions of dollars. Every year in the United States of America, our population spends about, almost, just a little bit below $5 trillion. It's a massive amount of spending that our people spend. The same way you spend on food and gasoline and rent, blah, 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 our population spends on healthcare. Remember that America is the third most populous country on earth. Number one is India with 1.5 billion people. Number two is China with 1.4 billion people. Number three is America. America, we are right now, October 2025, that I'm recording this video, we are a little bit below 350 million people. 350 million people. Think about that. It's a massive amount of people. Now, we are not yet at 350 million people, but we're going to be there in just a few years from now. Maybe in 10 years, right now 340, 300, it doesn't matter. In a few years from now, we're going to be reaching and surpassing 350 million people because we keep bringing a massive amount of immigrants from overseas. Right? As if there wasn't enough poverty and homelessness and deficit and in America and addictions and poor people and blah, blah, blah. We keep bringing, and I'm one of them, millions of illegal immigrants and millions of immigrants every year into our country. Hey, come on in. Eventually, one day, somebody's going to decide, hopefully our country is going to decide that the ship is full and we need to stop bringing millions of people every year to our country that has already, remember the national debt. Our national debt right now is at $38 trillion. Dr. B's credit card, my credit card right now, I have only about $250. My gasoline, my little food. I don't eat much. I don't spend much. I have only $250 and I'm going to pay it at the end of the month, right now, October 2025, right? Our country, Uncle Sam, the national debt, credit card debt is $38 trillion. And we think it's not enough, so we bring more people, more poverty, more poor people, despite having millions of homeless, millions of veterans, millions of our children go hungry in bed, millions of our minorities, black, Latinos, Asians, live in absolute poverty, right? It's crazy. We have not enough money to build shelters and all this stuff, and despite that, we keep bringing more people. Let's make it hopefully one day 500 million people. I mean, I don't understand the politicians in Washington. Why is it that we keep bringing millions and millions of people every year, despite already being 350 million people, and despite our national debt climbing every year by $1 trillion? It's already at $38 trillion. So our country spends massive amount of money on healthcare, and it's gonna get worse and worse and worse. And the three reasons that I'm telling you about the massive cost of healthcare in America, number one is, of course, what I just told you about, is that we are the third most populous country on earth. We have so many millions of people already and bringing more that the cost of healthcare is going up and up and up and up and up and up and up. The same way the cost of housing goes. The more people you have in a country, the more competition for housing, the more competition for food, the more competition for renting, the more competition for everything, right? So the cost of goods and services keeps going up, the cost of rent keeps going up, the cost of housing keeps going up. The American dream is gone because it's impossible. It is impossible to provide the American dream to 350 million, and in some years we're going to be 500 million, 400 million, 400. It's just impossible. It is impossible to feed 350 million people, to house them, to bathe them, to give them good food, sanitation, dental care, eye care, surgical care, prevent. It's just impossible. It's like being a father. I don't have no wife and no kids, right? And I make pretty good money. But let's suppose I had a wife and I had 50 kids. Well, how am I going to, even with my great income as a doctor, how am I going to afford to take care of 50 kids? There's so much I can do, right? Because having 50 kids, you can afford 50 kids if you are a billionaire or a multimillionaire, right? Then you can afford 100 kids. Right? Like the prince of freaking Saudi Arabia, who has 50 wives, and from each wife he has 10 kids. So the guy has 500 kids. He doesn't even know them all, but he doesn't care because he's a multi-billionaire. Right? But so it's the same for our country. We just don't have enough money. We just don't have enough room. We just don't have enough place, right? The more people in a country, the more consumption, the more competition, the more production of waste, garbage, pollution. Just look at India and look at China. Those of you who have never been to India, the number one most populated country on earth, I want you to go to India. I want you to go to Pakistan. I want you to go to Bangladesh. I want you to go to Manila, Philippines, and see what overpopulation does to a city, what overpopulation does to a country. It just destroys the city, it destroys the country. Those who haven't been to the favelas of Rio de Janeiro, just go over there and see what poverty is. Go to the slums of Calcutta, India. Go to the slums of Manila and see what overpopulation does in terms of pollution, in terms of consumption, in terms of crime, in terms of destruction, destroying the country, the environment, everything. So our elite in Washington, D.C., right, despite our national debt, despite our already overpopulation, I live here in the city of Mountain View, California, there's no room. It is rush hour at any time of the week, any day of the week, any time of the day or night. It is rush hour, rents are going up, mortgages are going up, food is going up. I mean, it's crazy. The overpopulation, I can feel it. California has completely changed from the many years ago when I came here in this beautiful, once beautiful state of California. It's all gone because massive amount of people. And people don't want to live in the desert, right? People in the desert, we need to preserve them. We cannot just go build homes in the desert. You destroy the environment. We cannot build home and raise all the forests and everything. You're going to destroy the environment. So there's so much we can do in order to support people, to support the world poverty by bringing more people to America. It is a very difficult debate. So that's the number one reason why the cost of our healthcare is going up through the roof, and it's not going down. It's going to get even worse and worse and worse. We're going to be one day like India, Pakistan, China. Means the population will be just the rich and the powerful will get the best healthcare, and the regular people will have to struggle, and the poor people will get no healthcare because there's just no money. Number two, second reason why the cost of healthcare in America is climbing ever non-stop and will get worse and worse and worse, it is this one. It is the compensation of the healthcare professionals. Healthcare professionals. It is unbelievable to see how much doctors and nurses and chiropractors and dentists and any medical technologist, whether it's X-ray, ultrasound, anybody, nurse, doctor, non-doctor, my God, the money they make compared to Canadians, Australians, New Zealanders, European, Germans, I mean, it's crazy. They make 3 to 4 times more money than their equivalent doctor, surgeon, nurse, chiropractor, dentist, physician assistant, anybody in healthcare in America make at least double what they make, the same job, the same training, the same number of years of study in Europe. It is crazy. I mean, when you think about how much we spend on healthcare professional, it is crazy. 6-figure salaries, 1 month of benefits, full pensions, and this and that, and vacation. I mean, it costs millions of dollars. Remember that for any healthcare institution, whether it's a public hospital, a private hospital, a public clinic, or a private clinic, or a doctor's office, or a dental office, it doesn't matter. 70% of the revenue of the cost, 70% of the cost of running that medical business goes to the compensation of the employees. So if you're a doctor, a dentist, if you're a dentist and you have your own private dental clinic, 70% of the money that you make will go to compensating your staff, the receptionist, the secretary, the dental assistant, this and that and this and that, paying the rent, paying the bills, paying the electricity, the service of your dental equipment. Same thing for any doctor in private practice. At our beautiful cardiovascular clinic in the city of Mountain View, the revenue of the clinic, the money that our private clinic makes, 70% of it goes to overhead. The compensation of the employees, plus, of course, the electricity, the rent, blah, 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 blah. Same thing for a hospital. The vast majority, by far, of the cost of running a hospital, public, private, or a clinic, private or public, is the salary, the compensation of the employees. It's unbelievable how much USA doctors and nurses and any medical, doesn't matter. They make at least 2 times what they make in Canada, Australia, New Zealand, Great Britain, and blah, blah. It's unbelievable. And they make probably 5 times more than what they make in developing countries. In developing countries, medical professionals, they make no cut. So that's why they all want to come here. Why do you think all these doctors from Pakistan, India, China, Africa, why Middle East, why do you think they want to come here? Because a surgeon in Pakistan is going to make the equivalent of maybe $3,000 a month. I mean, it's crazy, right? Whereas in America, he's going to make 10 times this at least. It's crazy. That's why they all want to come here. The third and last reason why the cost of our healthcare keeps climbing and climbing and it will never go down is this cost of medications. Remember that America is the #1 country on earth with the highest cost of prescription medications. Nowhere on earth do prescription medications cost so much than here in the United States of America. And the reason is very simple. Pay attention to this. America has 4% of the world population. And America uses about 13% of the prescription medications on earth. 13% of prescription medications are written here in the United States of America, 13%. However, the pharmaceutical industry, they make 75% of their profits in the United States of America. Means everywhere all over the world, the pharmaceutical industry, these big drug corporations, they sell their drugs to the government over there very cheap. They don't make any profit or barely any. But they say, you know what? We're going to use the American citizens as a cash cow. So they're going to milk us, the American citizens, while giving free medications or at no cost at all to all the other countries on earth. I mean, you know very well, people go to Mexico, people go to Canada to buy their prescription medications. They order them from Europe, blah, 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 if they have family members, because it's so cheap over there. Because the drug makers, the pharmaceutical industry, they decided that it's a good idea to rip off, to milk the American consumers, and they make 75% of their profits in America. Think about that, despite us being only 4% of the world population and despite us making up only 13% of the prescription drugs in the world. Now, the new administration right now, October 2025, has passed an agreement with Pfizer and hopefully with other drug makers to no longer rip off the American citizens. Hopefully that part will get better. Means the drug makers ripping off the American citizens, hopefully with time, as the new administration is signing more contracts with these drug makers to stop ripping us off, hopefully things will get better. But then we will be stuck still with not only our overpopulation that keeps growing, but also the compensation of the healthcare professionals. As long as healthcare professionals will keep making these crazy salaries, and I'm one of them. I mean, think about it. A nurse in America, a nurse right here in California, a starting level nurse makes per year, without counting benefits in terms of pensions and vacations, just her money that she gets paid, she starts easy at $100,000 per year. A starting level nurse right here in California, they have this crazy salary for a nurse. In Europe, a starting low-level nurse, no experience, she starts at 25,000 euros, which is about $30,000. So in the US, an entry-level nurse makes 4 times what an entry-level nurse makes in France, Italy, Spain. Now, Germany and England pay a little bit more their healthcare professionals, but still nothing compared to the US. Canada pays a little bit more their healthcare professional, but again, nothing compared to what they get here in the US. But in France, where I worked, in Italy and Spain, where I worked, an entry-level nurse, no experience, she makes 25,000 euros per year, which is about $30,000. And in that, she has to pay half of it in tax. I mean, to tell you the difference. As long as the healthcare professionals in America will make these outrageous compensation, there is no way we will ever afford universal health care, because there's this huge debate in America about a single payer system, universal health care, taxpayer sponsored healthcare, like in Canada, Australia, Europe, everywhere. Every country, developed country, has a taxpayer sponsored healthcare, right? America is the exception, but we will never be able to achieve that as long as our population keeps growing like this, and as long as the cost of healthcare is so high because of this huge compensation of healthcare professionals and the huge cost of prescription medications. So the doctors, the surgeons, the chiropractor, the dentists, and the nurses, and the millions of other healthcare professionals will have to accept to have low salaries and compensation like those in Canada, Australia, New Zealand, and Europe. If people in the United States of America want to have taxpayer-sponsored healthcare, what they call free healthcare. It's not free; it's paid by the taxpayer, right? And that's the problem. So don't forget, number one, overpopulation. Number two, the compensation of the healthcare professionals. And number three, of course, the cost of prescription drugs. In addition to prescription drugs, of everything else in healthcare, syringes and catheters and everything that is made by the biomedical corporation, they just rip us off. They're going to sell you a catheter here, for instance, let's say $20, a little catheter, whereas in Europe it's going to cost just €1. So it's 20 years. Everything in medicine, every product in medicine, the American citizens are being milked, they are being ripped off by the pharmaceutical companies and by the biotech corporations. I love you guys. Dr. B loves you regardless of your gender, ethnicity, color of your skin, religion, blah, blah, blah. Dr. B promised that I will always, always, always uphold my Hippocratic oath and love every human being regardless of their gender, their race, their political affiliation, their sexual orientation. I don't give a cazzo, and I promised during my Hippocratic oath that I took more than 30 years ago when I graduated from high school, from medical school. I apologize, it's getting late. That I will always put your benefit above mine. I will never, never, never also bring you any BS. Everything I tell you is based on the scientific evidence, the fact, the science. I love you guys. Thank you for your comments, your viewership, your criticisms, your encouragements, your messages of affections, and it's really mean a lot to me so that I can hopefully expand this channel and reach more people with my knowledge and my science, guys. Put your comments, your question, any cazzo you want to put down there. I'm open to criticism. I have received some criticisms and I respond also to criticisms, and I love people regardless. Thank you very much. Kopkun Mac, Kopkun Nakrap, Sawadee Krap, and I hope to talk to you in the next video. Bye-bye.